Hello, and welcome to Dr. B Talks About Nosebleeds, where I try to answer the question, Doctor, why is my nose bleeding? With me, Dr. John Burgoyne. I'm a practicing otolaryngologist with over 30 years experience dealing with nosebleeds here in Austin, Texas, and I'm happy to be talking to you today. So, nosebleeds, I'm just putting it up here, the medical term for that is epistasis. So if you ever see epistasis, that just means nosebleeds. Nosebleeds are super common. 60 to 80% of people have or will have nosebleeds. So that's super common. We usually find it comes in either the under 15-year-old age group or the over 50-year-old age group. So it happens all the time. However, even though it looks messy, only 4 out of 2.4 million deaths in 1999 were due to nosebleeds. So really nobody ever bleeds just from a nosebleed. It just doesn't happen. It looks terrible though. I mean, if you think about it though, if I went to give blood at the blood bank, they'd take a pint out. A pint of blood will paint an entire wall. And you have to keep that in mind when you see it. It's really scary, but significant blood loss is really rare. I have to say though that sometimes you have people who are otherwise sick, and if they start bleeding from their nose, that often means that something bad is going on, so you need to take care of it. So what is it about nosebleeds? What happens? Well, if this is a side view of the center part of the nose, this is the septum. These are all the little blood vessels that come into the septum, and they almost all come together here in the front. That's just right in the front, just right there. And most bleeding is either from tearing one of those blood vessels or dryness and cracking and chapped nose. Tearing a blood vessel, I mean, really, we're mostly talking about somebody putting a finger in the nose. This is why we have so many kids and adolescents who have nosebleeds. But we're mostly going to talk about the dryness, a chapped nose. What happens here? Well, crooked anatomy is one of the big deals with this. If you have a septum that's supposed to be straight and it has a knuckle on it, the breathing past that part that's sticking out will cause dryness and chapping there. It'll also cause it on the inside because there's the eddy type flow around that. So a crooked anatomy will lead to dryness. Runny mucus. So if you have a cold and your mucus is really watery, that can cause chapping and dryness. It sounds backwards, but if you think about it, when you lick your lips, they don't get moisture, they get more chapped. And the same thing happens with the nose. If you're putting a large amount of runny mucus through the nose, you're going to get more dryness and more chapped nose. On the same line, using saltwater irrigations or saltwater nose sprays also dry it out, simply because it washes away the normal mucus layer that's supposed to be there. And of course, dry air doesn't help. I see a lot more nosebleeds in the wintertime because people heat their homes and the air in the houses becomes dry. I mentioned that a lot of these nosebleeds are in the over 50 age group, like me. And why is that? Well, for one, we tend to have more messed up anatomy. This is a person with a crooked septum that's got a real point sticking out there that you can imagine why that would dry in the breeze. But septums keep growing. That's why old people have big noses and big ears. And so a little bit of a crookedness can get slowly worse over time. So older people have more messed up anatomy than young people. Second thing is, we have stiffer blood vessels, so they can crack more easily. So if you have a chapped nose and your blood vessel cracks more easily, then it's going to bleed more. Our mucus gets runnier the older we get. You may have noticed that every old person you ever knew had to carry a handkerchief, or my grandma always had a Kleenex up her sleeve, and so did my mom, and so does my sister. I mean, our noses get runnier. More drying, less lubricating. Another thing that happens as we get old is our lining tissue just gets thinner, so it's easier for it to break. And finally, older folks are more likely to have high blood pressure and can be on medications that can make bleeding more problematic. A lot of older people are on blood thinners, for example, and that can make your bleeding just a lot more. Okay, great. So most of the bleeding is from the front of the nose. It can be from dryness and cracking or from manipulation with your finger. But when it starts, what do? First thing, remember, don't panic. It's not as bad as it looks, and that pint will cover 50 square feet. So don't panic. You're going to be okay. So what do you do besides not panicking? Well, sit up with the head tilted forward because you want to be sitting up, which reduces the pressure head, so you have less likely, so that'll slow down the bleeding. And you want to lean forward because if you lean back, any blood that runs down the back of your throat is going to go down your throat and choke you, or you'll swallow it and it'll make you sick. So lean forward so that it either runs out the nose or will, if it goes into your back of your mouth, you can spit it out. Blow out any clots that are in there and spray it with some Afrin. Afrin shrinks the blood vessels in the nose, and so if you can spray it, it'll help to stop things. But it won't work if your nose is full of clot, so you have to blow the clot out. Oh, by the way, clots are normal. Sometimes people come in and panic and they're saying, oh my gosh, doctor, there was this giant clot in my nose. To me, that just means that's awesome. You've just proven that your body clots normally. So once you've done that, then you want to be leaning forward, pinching the nose, and pushing it into the face. So let me explain that. When I say pinching the nose, you come down right below where the bones are, you pinch it hard so that they sound like this, and while pinching it, you push really hard into the face. If you're doing this well, it's a little uncomfortable, and you can do it to yourself, but it's a lot easier to have somebody standing up doing it next to you. You can get better pressure on it. And you want to hold that. You want to hold that for as long as you reasonably can, which for most people is about 10 minutes. And then if that, and don't keep looking. Just hold it. Any blood that gets routed around the back, the person can just spit it out. So that's the best way to stop a bleeding. What if that doesn't work? Well, it's time to go see the doctor. Really, this is one of those conditions where if you can get into an ENT office, if it's during the day, you're going to have a lot better luck. Typically, if you call my office and say, I've got an active nosebleed, we'll squeeze you in. But if it's not possible to get into an ENT office, probably an urgent care or the emergency room is a better bet than your primary care doctor's office, because most primary care doctor's office don't have anything to do to stop the bleeding. Speaking of that, what will the doctor do? Well, you've often heard of cauterization, which means burning the bleeding vessel. Cauterization is not a magic cure. I have had people who've said, listen, I have nosebleeds all the time. I want you to cauterize it, then I want to worry about it ever again. No, it'll stop the bleeding that's happening right now, but it doesn't change any of the things that led to the bleeding. So it's not a magic cure. It can be done with either electricity or chemicals. And basically, it just puts a good scab on the spot. About 90% of my patients, that solves the problem, and they don't have further bleeding. That also means about 10% do. Of those 10%, about half of them, a second round of cauterization will get it to stop. But remember, it doesn't alter the underlying problem at all. And so, got to remember that. And it works best if there's a visible bad spot to cauterize. I don't want to burn the whole inside of the nose. And it works much better if I have a single spot that I can really stop. Another thing that a doctor can do is packing. And there are two major types of packing. We either use a sponge or a balloon. A sponge, it comes as like a compressed sponge, and we stick it in there and then it expands. Sounds awful, and you know what? It kind of is. But This is even more awful. You put this thing in there and you inflate it, and that puts a lot of pressure in the nose. But all of these can be very helpful. And most of the time, if you end up in an emergency room and you're bleeding that they haven't been able to control, they'll put one of these in. And that works. If you have packing, though, expect to stay in for at least 2 days. So this isn't the sort of thing where you put in a packing and then the next day I'm going to take it out. I won't. If you had a packing put in the emergency room, you come see me the next morning, I'll say, oh, that's awesome. See you tomorrow. Actually, expect for 2 days, but expect it to stay in for at least 4 days if you have a bleeding disorder or if you're taking medication that increases bleeding time, like aspirin or any of the blood thinners that a lot of older people are on. What if all that doesn't work? Well, surgery can then be done, which means to cauterize, pack, or tie up blood vessels under anesthesia. We can just see better and cauterize more powerfully if we have you asleep. We can pack more tightly if we have you asleep. We can do surgery to get at the blood vessels and tie them off. And if all that doesn't work, or sometimes we choose the other option, which is embolization. Embolization means block off an artery from the inside via angiography. What this means is they put a catheter in your artery, usually in the groin or in the arm, just like they do if they're checking out your heart for something. And they put a catheter up into the vessel that's bleeding and put something in there to block it off. It can be highly effective, but again, this is something that can only be done at hospitals. Okay, so you do this. One way or another, you got the bleeding to stop. Then what? Well, moisturize the nose. Okay, this is so important. If I cauterize it and it isn't moisturized afterwards, we're going to fail. It's so important to moisturize the nose. Saline is not moisturizing. Don't buy a saltwater nose spray and spray it up there. That is not moisturizing. You need something with oil in it, just like when your lips are chapped, you need chapstick. You can't moisturize your lips with water. You have to moisturize them with chapstick, and your nose is the same. We don't use chapstick in the nose. We typically use Vaseline or a mild antibiotic ointment. It just takes a little dab, and we just put it right at the front. Your body will move that in there, and it'll distribute the moisturizer without roughing it up. So I don't want you in there with a Q-tip. That's not what we need. We just need a little dab just at the front. And what I have people do is I have them do it like 3 times a day for a couple of weeks while it's healing, and then at bedtime after that for a while. Unless we've done something to correct the underlying problem, then using moisturizer at least while things are dry, like in the wintertime, might be necessary. And then, super important as well, don't blow your nose. Don't pick your nose. Don't put your finger in your nose. If you knock the scab off, it'll bleed because we didn't magically fix anything. We just put a nice, good scab on the bleeding vessel. If you have repeated nosebleeds, sometimes surgery to correct the underlying problem can be helpful. So if you have that crooked septum that's causing bleeding here and here, if you straighten it out, you can have a lot less bleeding. So consider that, but that's typically only something I do for bleeding really a couple of times a year in all the dozens or maybe, probably dozens a year of nosebleeders that I see. All right, so that's it. Thanks for coming to Dr. B Talks About Nosebleeds. Hopefully you'll have learned something about nosebleeds. Hopefully you'll have learned not to be as afraid of nosebleeds. And if you have had a nosebleed, but you're not having one right now, try moisturizing before you do anything else. That can be super, super helpful. But remember, Dr. B Talks About is not the practice of medicine. I'm not diagnosing or treating your disease, and don't expect that you can get personal advice from watching a YouTube channel. I wish I didn't have to say that, but I know from experience that I do. People think that they've become masters of the art by watching a little YouTube. So if you do need to see a doctor, go see a doctor. If you're in the Austin area, you're more than welcome to come see me. Dr. John Burgoyne, you can find me easily online. Now, if you enjoyed this, please make sure and push the like button down below. Share it. Subscribe to the channel and come back and check our other videos. We have a number of videos here that Dr. B talks about, and hope to see you again. Thanks.